This is an in-service training program presented by Nutrition Care Systems. Today's topic, tray accuracy and portion control. Upon completing this in-service, you will be able to, number one, list 2 reasons tray accuracy and portion control are important for resident satisfaction, and number 2, list 2 reasons why tray accuracy and portion control are important for the dietary department. So why is tray accuracy and portion control so important? The dietary department is responsible for making meals for many residents. Now, some residents are going to be on special diets. Most of the residents are going to be on a general or regular diet, but there will be some that will be on a modified diet, such as carbohydrate controlled, maybe a renal diet, no added salt, or texture modification. So that means the accuracy of the diet is an important factor for the dietary department to make sure that the resident receives the proper nourishment to meet their nutritional needs. Residents receive a special diet for a specific medical condition. For example, a no added salt may be for congestive heart failure or high blood pressure. Carbohydrate controlled diet would be for diabetes. Low potassium, sodium, and phosphorus would be for renal disease. And then a texture modification such as mechanical soft puree would be for dysphagia or any other chewing or swallowing problems. So other reasons why tray accuracy or portion control is so important is the doctor or the dietitian really rely on the fact that the diet that is being served is what was ordered. Tray errors can also affect the overall treatment of the resident's medical condition, and they can also affect the resident's medical outcome. And remember, too much or too little food can result in unplanned weight loss or weight gain. And those tray errors on residents with texture modification can have a devastating effect, could result in aspiration pneumonia and or death. Residents may be overwhelmed also if too much food is served, and inaccurate trays can result in citations from the regulatory agencies. So what's the importance of portion control to the dietary department? Serving too little food can result in leftover food. Serving too much food can result in running out of food, and also serving too much food can result in a higher food cost. And inaccurate portions, again, can result in citations from the regulatory agencies. Make sure you ask for clarification from the doctor or dietitian if you have any questions about a diet order, if it doesn't make any sense. Read the menu carefully and then provide portions that are outlined on the menu for the regular and therapeutic diet. You should be looking at your spreadsheets for those. And again, know which size of scoops to use for each food, and read the diet cards carefully for diet order, food likes, dislikes, allergies, and texture modification. Let's take a short quiz on tray accuracy and portion control. Question number 1. Which of the following is a reason for a resident receiving a special diet? A. Congestive heart failure, B. Diabetes, C. Renal disease, or D. All of the above? And the answer to question number 1, which of the following is a reason for a resident to receive a special diet? And that would be all of the above. D. Congestive heart failure, diabetes, and renal disease would definitely be reason for a special diet to be ordered. Question number 2, what is the importance of portion control to the dietary department? A. Serving too much food can result in lower food costs. B. Inaccurate portions are not a concern with regulatory agencies. C. Serving too much food can result in higher food costs. Or D. Serving too little food is okay since the food service budget will improve. And the answer to question number 2, what is the importance of portion control to the dietary department? And of course that would be C. Serving too much food can result in higher food costs. Question number 3, how can you assure tray accuracy and portion control? A. Ask for clarification about the diet order. B. Read the menu carefully. C. Read diet cards carefully. Or D. All of the above. And the answer to question number 3, how can you assure tray accuracy and portion control? Of course, that would be D. All of the above. Question number 4 is true or false. tray errors on residents with texture modifications could result in aspiration pneumonia and/or death. And the answer to question number 4 is true. We don't want to have tray errors at all, but particularly tray errors with residents with texture modifications could be very, very serious. Question number 5, again, true or false? It is important to know which scoop size to use for each food item. And of course, the answer is true to question number 5. Make sure you know your scoop sizes and which one for each food item. Thank you for your participation in today's program. Our goal is for you to use this information in your daily work. We hope you are well served today and every day. If you would like more information about our in-service training programs or dietitian consulting services, please contact us at 1-800-761-9200 or nutritioncaresystems.com.